set. Hello, my name is Savannah and I'm a physical therapy student at South College. Is it okay if we video this for educational purposes only?
Yes.
All right. So for this session, I'm going to be doing a manual muscle test and a range of motion test. So with the manual muscle test, I'm just going to be measuring the strength of your gluteus medius and minimus through hip abduction. So for that procedure, I'm going to need to place my hands along your leg and your hip. Will that be okay?
Yes.
All right. So to get in position for this test, I'm going to have you lie on your side facing this way, and we're going to test the leg that's on top. All right, I'm going to come around you. Good. All right. So I'm just going to hold your leg. You can bend your lower leg for support. Good. And we're going to try to keep this neutral position throughout the movement. So with hip abduction, that is bringing your leg away from your midline. So I'm going to stabilize right above your pelvis, and I'm going to guide you through passive range of motion of hip abduction. Good. And bring it back down. All right. So you had good motion. Any pain or discomfort with that movement?
No.
All right. So now I'm going to continue to stabilize at your hip, pelvis. I'm going to palpate right above your greater trochanter for your glute medius. And I want you to perform that same movement while I feel for a muscle contraction. Good. All right. I felt the contraction. No pain?
No pain.
All right. So now I'm going to have you complete another active range of motion. And during this one, at the top, I want you to stop. I'm going to apply pressure to the lateral proximal part of your knee. And I want you to resist me and not let me move you.
Okay.
All right, you can go ahead. Good, come down just a little. All right, don't let me move you. 1, 2, 3, 4. Nice, you can let down. Good job. All right, I'm going to give you a grade 5 because you had full range of motion and were able to resist max resistance. If you were unable to get full range of motion in this position, I will put you in a gravity minimized position, which is supine on your back. You would complete the same abduction movement, but just laying flat. We would do the passive range of motion, active range of motion with palpation, and then active range of motion with 2-finger resistance. Depending on how you, your range of motion, how you withheld my resistance, and your muscle contraction, I will give you a grade 0 to 2+. All right, for the next one, we're going to do a range of motion test. So we're going to do dorsiflexion. So for your position, you will need to lay face down.
Okay.
But before you do that, I will explain. I'll have this, it's called a goniometer. It is just a measurement tool so I can measure in degrees how much more movement you have at your joint.
Okay.
All right, so you can lay face down. Is it okay if I palpate some bony landmarks along your leg and foot?
Yes.
All right. So now just go ahead and flex your knee. Good. So dorsiflexion is basically like you're taking your toes off of the gas pedal. Yes, so you could complete 2 on your own. Good. And then 1 more. Nice. Good quality movement. Any pain or discomfort with that?
No.
All right. So now I'm going to line up my goniometer. I'm going to put the fulcrum on your lateral malleolus. I'm going to line up my stationary arm along the lateral fibula to the fibular head. And then I'm going to line up this movement arm parallel to the 5th metatarsal. So now I'm going to have you complete that same motion while I have the goniometer on here.
Okay.
All right, let me readjust. Good. Good. All right, you went 0 to 20 degrees. The AAOS normative range of motion for dorsiflexion is also 0 to 20, so you're right on target. And that's all. Thank you.
Thank you.